Is it okay if I come in? Thank you. I'm just gonna put these down really quick on a clean surface. Gonna give us some privacy, just some hand hygiene. Hi, my name is Anna. I'm gonna be your student nurse today. I'm just gonna be here for about the next 15 or so minutes. Before I proceed, would it be okay if I got your name and your date of birth? Thank you for that. So I have verified your provider's orders, and they do have an order for you to receive a NG tube for nasogastric gastric decompression. So with that, do you have any questions before I begin with that insertion of that nasogastric tube? Do I have your consent to proceed with the insertion of that NG tube? And then, for the sake of this return demo, as soon as I am done inserting that NG tube, I will be removing it, and I'd like to let you know that during the removal, you may experience some nasal discomfort and some gagging. And also, I do want to ask, do you have any pain right now? Or nausea? Or vomiting? My patient responded no to all of those. So I will be kind of just adjusting your head of the bed as well as the height of the bed and kind of proceeding. I've already done my hand hygiene. Just going to move this out of the way. I'm going to raise you up to the level of my hips. I'm also going to be raising your head of the bed up to a high Fowler's position. Verify. Alright. So I'm going to be setting up my table over here. I'm just going to do some hand hygiene one more time. What I'm going to do is raise this up definitely. I'm going to move this to the side and open this so that way I could just use this surface to put my tape. What I'm going to be doing right now is just setting up my two pieces of tape that will both be 3 inches long, and one of them I'm going to split halfway down the middle. I'm going to say that's about 3 inches. So I can put one there. And again, this is a clean work surface that I have this on. Another 3 inches. I'm going to try to my best to split this down the middle, halfway. Like a little pants. And then I will be adding one additional piece of tape so I can mark my NG tube after I've measured it for my client, so I don't need to have it 3 inches, but just enough so I can actually use that as my marker. So at this point, I am going to put on so I'm going to do some hand hygiene one more time. I'm going to put on my gloves. Again, just regular gloves. And I have some of my supplies here. I have my pen light. I'm going to be looking in the nasal passages. I'm just going to be looking for any signs of obstruction, nasal polyps, septal deviation, or irritation of the mucosa, and I don't see any. I'd also like to assess for the patency of your nares, so I'm going to ask you to just hold one nostril and occlude it and take a breath in, and then do that to the other one. So both nares are patent. So again, patency noted bilaterally. I'm also going to be assessing for my client's gag reflex. So I would use a tongue depressor and place that in the back of their mouth and note that gag reflex. I also take my stethoscope and I'm going to auscultate their lung sounds and their bowel sounds as well. Let's see. That should be good. And I'm going to place this to the side, but make sure it's readily available for me. Move this. I'm going to be setting up my NG tube. And I will just be measuring it really quick. Your instructor will be holding your lubricant for you, but my person is holding my camera, so I'm just going to have that ready on the side. You would otherwise apply some lubricant in your package, but I'm going to be measuring my NG tube. I'm going to be working from the tip of their nose to the tip of their earlobe, And then you can either then come down then to the tip of the xiphoid process. So again, I'm going to mark where I measured that out to. Put my piece of tape so I know where I should be inserting to. All right. And then I know it states that we're going to lubricate the catheter, but first I want to just set up my patient because once I have this lubricated, it's going to be a little bit messy because of the laundry detergent. So I'm just going to place that down in a package. I'm going to make sure that I have the cup and the tissues readily available for my client. I'm going to hand that cup to them. I'm going to instruct my patient that during the procedure, I will be asking you to take some swallows, and as you swallow, I will be advancing that catheter. I'm going to place this towel over here. During the procedure as well, if you need to communicate with me at any time and you need a pause, please just raise your hand so I'm aware. I'm also going to have this emesis basin just in case. And then other than that, I am going to grab my NG tube. I'm going to attach the piston syringe. I'm going to bring up a little bit of air, about 30. Have that readily applied. And so again, you guys will have somebody holding your lubricant. I just don't have that. So I'm going to do a quick little lubricant. So I'm going to apply lube to the first 4 inches of my distal end of my NG tube. Okay. And then what I'm going to be doing now is that I'm going to again be aiming back and down towards your ear. I have my syringe attached. I'm going to be inserting again into the nostril closest to me. So I've inserted. Once I pass that nasopharynx, I'm going to ask them to bring their head down, so their chin to their chest. The mannequin won't stay in that position, but we're going to say that their head is chin to chest. And then I'm going to ask that every time you swallow, I'm going to be advancing the catheter. So swallow, 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 swallow. And I'm going to be doing this until I reach my marked point of my nasogastric tube. And sometimes our mannequins don't go all the way to the point that we measured, so the best you can, but I would advance until where I have measured the catheter. I'm going to make sure to secure that catheter until I can tape it down so we don't lose it. I'm going to place that over their nose. Again, I'm going to be, and most institutions you could also have a securing device as well. Sometimes they wrap it a little bit differently depending on where you're at. So again, that is secured. I put my split tape first, and then you put, I feel like this is more than 3 inches, and place that on top to secure that. Okay. And so then now at this point, I would take my stethoscope again. I would auscultate my client's breath sounds, their lung sounds. And then I'm going to, again, see how my patient is doing. I'm going to inject in here. I'm going to aspirate about 5 to 10 cc's or milliliters of the gastric content. I have a little cup here with my pH strip, so I can remove that. Place the gastric content. I'm going to take my pH strip. I note that it is acidic, so I can pull back up my gastric content and then reconnect it, release that, and insert that back into the client. Once I'm done with that, I can put this back down. I'm going to take my little connector piece and clamp that. And again, I've asked my patient is doing okay. They don't need anything at this moment. I will be going into the removal, but what I'm going to do is leave this in place because I will be doing the removal. But before I do that, let me make sure, so I don't forget, I do need to secure this to your gown. I do not have a proper securing device here, so I'm just going to use a piece of tape for reference with this, but you do want to secure this to the client's gown before you do your whole removal. So again, I would make sure before I left my patient though that I left them in about 30-degree angle. And then again, I will be moving on to the removal. I think I leave my gloves on though for this because I'm moving straight into it, but otherwise, of course, you would have removed your glove, done your hand hygiene, reset your patient. But I've come back in, I will be doing the removal of your NG tube. So again, I had new gloves, did my hand hygiene. So I'm going to be removing the tape from your nose. Oops, this paper tape really stays pretty good. I'm gonna remove the tape or the securing device from the gown. This is very sticky. Okay, and so then now I'm gonna ask my client, please hold your breath, and while they hold their breath, I'm going to remove the NG tube gently and steadily while controlling and maintaining the tip of the catheter. Okay. Oops, very long. And so I'm going to inspect that tip of the catheter for integrity. Looks like it is still intact, so I can discard of all of my tube in the appropriate receptacle. You guys are saving your NG tube, so you can just place it on the table, but otherwise I would throw that into the garbage. Again, I can remove any items from my patient's bed, remove their towel, place this into the dirty linen receptacle, but again, just saving. I would go ahead and again offer any comfort. I can dry up the nose if needed, assess that my patient is comfortable while I am removing my gloves and doing my hand hygiene. Then I am going to start again lowering my patient. Again, it's a little bit of time to get all the way down. So again, make sure your patient is comfortable, how they've tolerated this procedure. I'm gonna lower the head back down a little bit for you, maybe to that 30. So again, I'm gonna make sure that the bed is in the lowest position, that rails are up if I had put them down at all. The bed is locked, call light is within reach. And then I thank my patient, and then I do my hand hygiene on the way up. Thank you.
Pass.